Hello, I'm Betsy Ross, and welcome to the Healthline program. Glaucoma is often referred to as the sneak thief of sight. Our first guest, Dr. Michael Halpin, will help us understand why early detection is the key. We'll meet a new healthy hero, Donna Tucker, in the HealthyLifestyles segment, and we'll learn why she's taken to kicking up her heels. That's all next and more on Healthline, presented by the Northern Kentucky Medical Society. Welcome to Healthline. We've seen it happen to many of our parents and grandparents. Gradually, they're robbed of their eyesight. Our first guest, Dr. Michael Halpin from Tri-State Centers for Sight, is here to help us understand what happens when glaucoma is the diagnosis. Welcome, Dr. Halpin.
Thank you, Betsy.
We hear about glaucoma, but we don't understand a lot of what happens to develop it. First off, just what happens when someone does develop glaucoma?
Okay. Well, in order to understand what glaucoma is, we first have to understand how we see, how vision is processed through the eye. Basically, light comes through the front window of the eye, the cornea of the eye, goes through the pupil of the eye, is actually focused by the lens of the eye, which sits behind the pupil, and is transmitted to the retina, the light-sensitive part of the eye, which is made up of many millions of nerve fibers. Those nerve fibers go to the optic nerve. The optic nerve transmits the visual impulse to the back of the brain, and that's how we see. When we develop glaucoma, there's damage to the optical nerve, usually from increased pressure inside the eye. That damage to the nerve causes gradual death to these nerve fibers, and death to the nerve fibers causes loss of vision, oftentimes from the peripheral vision to the central vision.
So what happens when we do develop glaucoma?
What happens is there's fluid made in the front part of the eye. It's made in this part of the eye called the ciliary body. It's called the intraocular fluid or aqueous humor. It flows through the pupil of the eye and then is actually drained through the front part of the eye through what we call the trabecular meshwork or the anterior chamber angle. Now, what happens with glaucoma, the fluid is being made, but these outflow channels are being clogged up, and the fluid cannot get out properly. So the pressure goes up, which causes damage to the optical nerve, which causes damage to the eyesight.
So who's at risk for glaucoma?
Well, just about any of us could develop glaucoma, but there are certain subsets that are much higher risk. People where there's a family history of glaucoma are particularly at risk. The African American population is at much increased risk, about 8 times what Caucasians develop. People with elevated eye pressure, elderly people, especially over age 60, are much higher at risk, and people with high degrees of nearsightedness and farsightedness. Those are some of the at-risk people that have had ocular injuries, particularly blunt injuries to the eye in the past. People with thinner corneas are at higher risk. Health problems such as diabetes, high blood pressure, some people with history of migraine headaches are at a higher risk. Those are some of the high-risk categories.
So you mentioned that sometimes it sneaks up gradually and we don't even notice that we have this problem.
Absolutely.
So how do we find out?
Okay. Well, the best way to find out is to go in to see your eye doctor and have a complete eye examination. And during part of that complete eye examination, in addition to testing your vision and checking you for glasses and so forth, they will do glaucoma testing. And we do it on everybody. And part of the glaucoma test is to check the pressure of the eye. If that pressure is elevated, normal pressures are between 10 and 20. Most glaucoma patients' pressures are up in the mid to upper 20s or even into the 30s. That's a red flag that there might be glaucoma. Further testing includes actually looking into the eye, examining the optic nerve, checking the peripheral vision, because oftentimes the peripheral vision is affected first. And then there are other more sophisticated tests that we can do if there is an indication that there might be a problem.
Now, there are different types of glaucoma that you see.
That's correct. There are basically two different types, and there are various subsets in those types, but the most common type of glaucoma is what we call open-angle glaucoma. And where we talked about the drainage channels in the front of the eye, that angle is open 90% of the time in patients that have glaucoma. There's a second subset that we call closed-angle glaucoma, where anatomically the angle is very narrow and it can acutely close off. And those people actually can benefit because they have acute symptoms. They get pain, they get redness, they get immediate loss of vision. So those people actually are better off than people that have open-angle glaucoma in the fact that we can diagnose it early.
So once it's been diagnosed, then what? What do you do? What is the treatment?
Okay. Well, for the most common type of glaucoma, open-angle glaucoma, it's primarily a medical therapy, being eye drops. Either one or two different eye drops that we use to lower the pressure. If that doesn't control the pressure, then we use laser treatments to treat the outflow channels in the front of the eye to try to increase the drainage. And then more conventional surgery if we can't control it with either medication or laser treatment.
Can loss of vision be prevented? We hear about this happening and you can treat it, but you can't stop it. You can just slow it down. How can we really keep our eyes healthy?
Okay. Well, the way to keep it healthy is to have regular eye examinations, especially as you get older. Over age 40, especially if you have some of the risk factors that we talked about previously, you should have regular eye exams every 1 to 2 years. And, after age 60, probably every year, just because of the higher incidence of glaucoma. We don't have a cure, Betsy, but with early detection and proper treatment and proper compliance with that treatment and proper follow-up, you can maintain your eyesight.
And especially if you are older and are in those risk factors, like being African American.
That's correct, absolutely. African Americans, even at a younger age, are much more likely to develop glaucoma. So it's particularly with that population, and there is a mild increase in risk in even the Hispanic population compared to the Caucasian population. But African American population, it's the leading cause of blindness.
A lot of information here. Doctor, thank you so much for being with us today.
Thank you for having me, Betsy.
Explain this. And as we said, there is a lot of information. We have a booklet, a free booklet, that you can receive that tells you more about glaucoma. To get this booklet, just go on our website and we'll have the information for you right there. And we'll be back with Medical Minutes right after this.
Are you looking for an exciting career opportunity in the dynamic communications industry? Do you have a sales, customer service, or technology background? If so, Insight invites you to check out our team today. Visit our website at www.insightcom.com for a list of all our open positions. Insight offers excellent benefits, including free cable and discounted internet. Email your resume to nkyjobs@insightcom.com or stop by our Florence office and fill out an application today.
A great soul ballad is something very special. It's so much more than just a song you sing. It's music that gets deep inside of you. And now you can check out the complete 10-CD Classic Soul Ballads collection for 30 days for just $9.95. Even better, when you use your credit card, you'll get free shipping and handling, a savings of nearly $15. So order now with your credit card, and for just $9.95, bring all 10 CDs, 144 hits into your home. If it isn't the best collection you've ever heard, just send it back and owe nothing more. The Classic Soul Ballad collection is, to say the least, very, very special. And I know you're going to love it as much as I do. I'm Peebo Bryson. Please, enjoy the music.
Call 1-800-308-3900 for the Classic Soul Ballads. That's 1-800-308-3900. Call now.
And now the Healthline Medical Minutes. Typically, January is the month, and many of us make that resolution to lose a little weight. And according to the American Academy of Family Physicians, keeping a food diary is a good way to help you get a handle on exactly what you're eating. They suggest you write down everything you eat, including your condiments. Make sure you also note the size of your portions as well as what time you ate, where you ate, and if you ate your meal with someone. They believe by writing down this information and monitoring your eating habits, you may be more successful in your battle to drop a few pounds. And here's interesting news about keeping your brain sharp as you get older. Researchers are looking at whether computer exercises can improve memory or improve slower thinking skills. Brain fitness is a new concept, and researchers are just beginning to look at the effect of utilizing brain exercises to help people keep a mental edge as they grow older. Researchers already are quick to say that these brain fitness exercises most likely won't stop brain aging, but as more studies are done, they may find that targeted brain exercises will help improve the performance of an older brain. So it looks like in the future, those computer and video games won't just be for the kids. And finally, how ice can help you in an emergency. No one likes to think that we might be involved in a medical emergency, but if you happen to be rendered unconscious, how would emergency medical personnel notify your family? Family members often know medical history that could be important during your treatment. ICE is the acronym for In Case of Emergency, that medical emergency workers are encouraging everyone to program in cell phones after the name of the person you would want contacted. Now, it only takes a minute to add the letters ICE after a name, and it could help save your life. That's the Medical Minutes for this edition of Healthline. We'll be right back after this break.
I'm Patrick Crowley. I've been covering news and politics in Northern Kentucky for over 2 decades. I'm the political writer for the Kentucky Enquirer and host of On the Record on ICN6. Every week I find out what's going on behind the news from the people making the news. The governor, congressmen, city officials, county officials, controversial figures, business leaders. There's nothing off the record when they're on the record.
Well, I can't walk.
I can walk, but not very far.
I can't even stand anymore.
And it gave me no freedom.
If you or a loved one suffer from limited mobility, we have incredible news. Now you may qualify for your very own new Invacare power chair or scooter at little or no cost to you. Call Mobility Products Unlimited right now to begin your free pre-qualification process. Invacare's powered mobility products are comfortable, stylish, easy to maneuver, and go anywhere.
And yes, you can get back out there too with Invacare.
So pick up the phone and call Mobility Products right now, risk-free. Their friendly specialists handle all the paperwork and make it fast and easy to begin the pre-qualification process for your very own Invacare power chair or scooter. You could get yours within just days. There's no pressure, no obligation, no cost for the call. And your satisfaction is guaranteed.
So call 1-800-913-5854 right now. That's 1-800-913-5854. Friendly mobility specialists are standing by.
The Milson Walker Financial Group, full-service financial advisors, can be seen each weekday morning on the chat room on ICN6. Tune in as Robert Walker or Gary Milson talk about the current ups and downs of the stock market, as well as financial news from around the world and what it may mean to you. The Stock Market Report from Milson Walker Financial Group can be seen Monday through Friday on the chat room, 10:25 a.m. on ICN6.
Welcome back. In December, our guest, Dr. Dwayne Smith, explained the procedure of weight loss surgery. Well, today we have one of his patients. Let's take a look at her story.
I decided to have gastric bypass surgery after my son came to me, and he was about 9 at the time, and asked me, "How long do you want to live, Mom?" Because I'd always teased him about being an old mom. And I made a joke when he was there with me, but when he left, I thought about that and thought, if I don't get this weight off, I'm going to be lucky to see him graduate. My life before surgery was active socially, but physically I led a very sedentary lifestyle with no formalized exercise whatsoever. I chose karate as my exercise of choice following the surgery. I had been with my son in karate, really believe in what it does for a person both physically and psychologically, how the different good things that it does for a person's body.
The first time I met Donna was when she was getting her son involved. And a few months into that, she started showing interest in getting involved in an exercise program for herself. Donna is a great student. She's got a busy schedule, and she's here all the time. So I know this is a huge part of her life, and it's good to have students with that type of dedication and loyalty.
Her weight loss has kickstart the whole family into taking better care of ourselves, being in better shape, and in better health. And it's been a focus not only on her, but spun off to my son and I.
If I were giving advice to someone considering having the surgery, I would say two things. One is to pursue it as a complete lifestyle change, expect that. And then secondly, to expect imperfection in living it out. You're not going to live it perfectly, but to do your best to follow exactly what they tell you.
And Donna is here with us now to share her story. Congratulations. How about you?
Thank you.
How about that?
Thank you very much.
Can we ask how much you've lost?
Sure, I'm happy to say 151 pounds.
That's
lost
awesome.
151 pounds.
Now, you had the surgery when?
February 28th, 2003. That date I'll always remember.
You said that it was really an issue that you dealt with all your life, but it was really your son that kind of was the tipping point that said, okay, I've got to do something about it right now. Why did you choose this method?
Well, I tried every other method and failed at it. I think when people get to the point of gastric bypass surgery, they've tried everything else and haven't been successful with it. And I thought I had seen Al Roker on the television, and it just so happened that when I was making the decision, I saw him, and I saw Carney Wilson. That was another person that I read about and saw. So from there, I began to research it.
Was it a tough decision to make?
Not at all.
Really?
No. I read everything I could find out about on it. I saw the surgery performed twice via the internet, and the decision itself was very easy.
You talked about in the piece doing karate, and that's one of the things that your doctor requires you to do, because it's not just eating, but it's the exercise as well.
Yes.
It seems as if it's not just changed your life, but your entire family's lives.
Yes. Our son brought me into this. He was 9 years old at the time and got his black belt when he was 9.
Oh, wow.
So I was in the waiting room watching, and I was always, as I said before, always convinced of the value of it. And then we pulled my husband into it. So it's a family thing.
Yes, it is. How's this surgery changed your life?
I'm the same person I was before the surgery. I'm more active physically. I'm able to do karate. I would have never been able to do that. I can golf longer and better with my husband, with my son, and I can bicycle with my son. And I can lug my harp around. It's a lot easier. So I think physically is how it's mostly changed.
Has it changed you emotionally, the way you look at yourself, the way that you look at the future, perhaps?
Oh, that's a hard question, Betsy. I think that I underwent a lot of changes. I think it is a drastic change to you. I can't really divide out what of it was with the surgery or what was with the karate. I've always felt that that having obesity is not a moral issue. It's an issue that I managed to compartmentalize. So the only thing I didn't really do or try to do before the surgery was physical type things. I would say I'm probably a different person, but not deliberately.
And do people look at you differently now?
Definitely.
Really?
Definitely. I'm a professional musician, and I think that I get more jobs now than I would have gotten before.
Donna, your story is inspirational, and it's wonderful that you have been this successful for this long, and congratulations, and best of luck to you and your family. You're all going to be out there doing karate.
Thank you for having me.
Oh, that's terrific. Thank you so much. After this break, we have local doctors answering your medical questions in our House Calls segment. Stay with us.
Are you looking for an exciting career opportunity in the dynamic communications industry? Do you have a sales, customer service, or technology background? If so, Insight invites you to check out our team today. Visit our website at www.insightcom.com for a list of all our open positions. Insight offers excellent benefits, including free cable and discounted internet. Email your resume to nkyjobs@insightcom.com or stop by our Florence office and fill out an application today.
You're stuck on a treadmill. You're making minimum payments on your credit cards, and you just don't get anywhere. Let Consolidated Credit tell you the truth. When credit card companies are charging high interest, it's virtually impossible to pay off your debt. Let's say you owe $5,000 and your rate is 21%. Of your $100 minimum payment, $87 is interest. It'll take you over 33 years to pay off that debt. Call Consolidated Credit. They'll get the credit card companies to reduce or eliminate your interest. Get off the treadmill. Get on with your life. Call Consolidated Credit. They're the freedom people.
Call now. 1-800-530-5706. 530-5706.
Consolidated Credit. When credit card debt is the problem, they're the solution.
Miss a minute in Hollywood. Who's with who, wearing what?
E-News wants to hook you up.
Come on. You don't want to hear the latest headlines from your friend. You want the latest first.
So we're going to give you 2 chances to watch E-News weeknights at 7 and 11.
So what's happening as we speak?
A lot.
One more. Watch E-News weeknights at 7 and 11 Eastern and Pacific. We love it too.
E-News weeknights at 7 and 11 only on E! Insight Channel 64.
Welcome back. Our House Calls segment gives you, the viewer, an opportunity to ask questions about your own medical concerns. We have doctors from the Northern Kentucky Medical Society ready to answer your questions. Our first question comes from Jean in Grant County. My daughter is 2.5 years old and her toes turn in when she walks. I'm concerned that she may have something seriously wrong with her legs or the bones in her ankles and her feet. Should I be talking to an orthopedic specialist? Well, we asked Dr. Gordon Eyre to answer this question.
Jean, toeing in a child between the ages of 1 and 3 is not all that uncommon. We think that it's due possibly to some twisting in of the legs below the knee and at times twisting in around the hips. We used to treat this with shoe inserts or a variety of braces, but we found out over the years that this is almost all of the time harmless and will gradually subside with age and growth. There's a very unusual instance of a more serious cause, and I think for that reason, the next time you talk to your family doctor or your pediatrician, you should ask them about it.
Dr. Lisa Miller answers this question from Gary and Jody in Walton. We're first-time parents, and recently our 4-month-old baby daughter, Ava, ran a temperature of 101 during the night. Is this normal for a baby that age, or should we call our doctor if this happens again?
Well, Gary and Jody, I wouldn't say that 101 degrees is a normal temperature for a baby. Even a teething baby shouldn't run a fever over 100. But we really want to know what else is going on with your baby. Is she more fussy? Is she eating okay? Is she sleeping okay? Has she been around anybody else sick? Does she have any other symptoms like a fever, like a cough, diarrhea, a rash? Those are the things that are going to help us decide whether she needs to be attended to tonight or whether you can just wait and call the office in the morning. So we always worry when there's a fever, but you want to assess the whole picture before deciding whether to call the doctor. We're always happy to speak with you anytime you have concerns about your baby.
And our final question comes from Mike in Ludlow. I'm a 40-year-old man and in good overall health with no symptoms. Should I be getting a colonoscopy, or should I wait a few more years? We went to Dr. Michael Jones for this answer.
Mike, that's a good question. You sound to be an average risk patient. For average risk patients, we recommend having a screening colonoscopy at age 50. High-risk patients are described as patients who have a family history of colorectal cancer, including a first-degree relative who may have colon cancer, patients who have inflammatory bowel disease, or a family history of polyposis syndromes or colon polyp syndromes. For those patients, we recommend a colonoscopy at age 40, unless they have a first-degree relative who was diagnosed with colon cancer earlier. If so, we recommend a colonoscopy to be done 10 years before their earliest first-degree relative was diagnosed. If you have any warning symptoms, including blood in your stools, altered bowel pattern, abdominal pain, or weight loss, we recommend that you see your doctor immediately for evaluation of those symptoms.
And our thanks to Dr. Gordon Eyre, Dr. Lisa Miller, and Dr. Michael Jones for their professional medical advice. Well, we're out of time on this edition of Healthline. Of course, we'd like to thank all our guests, Dr. Michael Halpin and Donna Tucker, for their participation today. Now, if you missed some of the information listed on today's program, or if you have a question that you would like answered in our house call segment, I'll be sure to go to the Northern Kentucky Medical Society website and click on the Healthline button. All of our program information is listed there, and you can email your questions. Now, each of our Healthline programs will air several times each month, so make sure you check the listings for the days and the times. We hope you will join us again next month for a new program when we talk about those medical issues that will help keep you and your family healthy. Goodbye for now. I'm Betsy Ross. This has been Healthline, presented by the Northern Kentucky Medical Society.
Well, I can't walk.
If you or a loved one suffer from limited mobility, we have incredible news. Now you may qualify for your very own new Invacare power chair or scooter at little or no cost to you. Call Mobility Products Unlimited right now to begin your free pre-qualification process.
And yes, you can get back out there too with Invacare.
So call now risk-free. Friendly mobility specialists handle all the paperwork. You could get your Invacare power chair or scooter within just days.
Call 1-800-621-5072.
Hi, I'm Jackie Shear, the host for Job Connections on ICN6. The Bank of Kentucky sponsors this weekly look at job openings in Northern Kentucky. Each week, we feature 3 guests who highlight the current openings they have available. One constant is the Kentucky Office of Employment and Training. Every program has an employment specialist discussing real job openings. Job Connections Daily, only on ICN6.
I'm Patrick Crowley. I've been covering news and politics in Northern Kentucky for over 2 decades. I'm the political writer for the Kentucky Enquirer and host of On the Record on ICN6. Every week I find out what's going on behind the news from the people making the news. The governor, congressmen, city officials, county officials, controversial figures, business leaders. There's nothing off the record when they're on the record.
The ballads are back. And now they're bigger and badder than ever. It's Monster Ballads Platinum Edition, the 32 hugest power ballad hits of all time on 2 unbelievable CDs. You can't get this incredible 2 CD collection in any store. Don't miss this opportunity to feel the power of platinum. Order this awesome collection online at MusicSpace.com. Get Monster Monster Ballads Platinum Edition now, because every bad boy still has his soft side. To order, call the number on your screen or log on to MusicSpace.com. Rush delivery available.